We were one of the first to reopen. In fact, in April of 2020, we reopened our parks and our beaches. We were mocked, we were ridiculed, and we were criticized. And it turns out we were right.
To the eye of the beholder, hindsight is always 2020. And as we slowly come up on 2 years of the COVID-19 pandemic entering our lives, a lot of people are looking back to see where we've been and where we are now. You may remember that the First Coast was particularly targeted nationally, with pictures of a packed Jacksonville beach going around, which were not current at the time, with the term Florida morons being thrown around. Well, that's where the mayor's comments come in that video from. And we asked the mayor about this today.
I think people have to exercise their own precautions, do what they think is right and safe for their family, but I'm going to continue to be an advocate for people being able to lead normal lives.
So with the pandemic still going on and the current Omicron surge, some of you may be wondering if it is time to advocate for living our normal lives. On your side's Haley Harrison spoke with a Jacksonville doctor who says strategies moving forward are really going to be up for debate.
The public health response has been different across the board, from country to country, city to city, since the COVID-19 pandemic began almost 2 years ago.
And I would argue that we should look to see what works and then people can decide how they should approach things.
Dr. Michael Koren, who heads up local vaccine trials, says, for example, New York was hit hard early on during the pandemic and has implemented strict policies throughout. The most recent, a mask mandate for all indoor public places that don't have a vaccine requirement. Florida has been hit hard at different parts, but he says the state did something very good in the beginning, which was isolating the nursing home and elderly community.
So if you look at the data between the two states, they're actually very, very similar, and the approaches have been a little bit different. So, whether or not one strategy worked better than the other is certainly something that's open for debate.
But Dr. Koren says two things are for sure.
The public health response should be based on the characteristics of that particular virus. So for COVID-19, one of the most important characteristics is that it's a horrible virus in older people and people with pre-existing conditions. We got to really protect the most vulnerable people.
He says another key message for COVID-19 going forward is vaccines work well at preventing severe illness, and a strong vaccine strategy should remain in place. I'm Haley Harrison, First Coast News, on your side.